Have you ever heard of nurses making $10,000 a week? It's called strike nursing, and today I am breaking down what strike nursing is and whether or not it's worth it. Hi, nursing friends. Welcome back to Passports and Preemies. I'm Kylie. I have been navigating this crazy world of travel nursing for almost a decade now. I am here to help you maximize your time off, explore the world, and make more money as a travel nurse and as a regular nurse. If that sounds good to you, make sure to hit subscribe and leave me a comment. What is strike nursing? Simply put, strike nursing is when a hospital hires nurses to fill in for the staff nurses that are on strike, and this is a temporary contract. Strikes generally happen for a number of reasons, including unfair wages, unsafe nurse-to-patient staffing ratios, and just unfair working conditions. As a strike nurse, you are stepping in to keep that hospital running while the staff nurses go out on strike. This can be a few days, it can be one shift, it can last for a few weeks, or in the case of St. Vincent Hospital in Massachusetts, it could last 301 days, which is the longest recorded strike in history. So why do hospitals need strike nurses? When nurses go on strike, obviously patient care has to continue. And you might be thinking, isn't this a waste of money for the hospital since they could just negotiate in good faith with the union nurses and maybe increase their wages or give them better staff to patient ratios? And you would think that the obvious answer to that is yes, because purchasing strike nurses costs a hospital tons and tons and tons of money. And this is usually as a last resort when the nursing union and the hospital cannot come to an agreement on their new contract. And this is exactly where the controversy comes in. Some nurses view this as taking advantage of the nurses who are actually on strike, because when those nurses are striking, they're not receiving pay, they're not getting their benefits. They are truly doing this for the betterment of the nursing workforce. While on the other hand, other nurses, usually those that participate in the strikes, see this as a way to make an insane amount of money in a short amount of time. Let's talk money, because that is why strike nursing gets so much attention. Strike nurses can make thousands of dollars per week and even more the longer that the contract is. But of course, the catch is that you are working 12-hour shifts, and sometimes you are required to work at least 6, sometimes 7 days a week. Not to mention, you get virtually no orientation, and your contract can end abruptly, although there is usually a clause in the contract that states you have to get paid out a minimum amount, whether or not the contract fully comes to completion. So yes, the money is insane, but that does not mean that strike nursing is for everyone. First, the work is truly grueling. You are oftentimes stepping into a very tense environment. You are working long shifts, and of course, you are facing resistance from the staff nurses who are on strike. Second, strike nursing can be very unpredictable. Sometimes you get a call just a few days before a strike starts, and they tell you, they ask if you're free, if you're licensed in that certain state. They don't tell you where you're going, what hospital you'll be working at, what shift you're going to be working. They kind of just expect you to get on an airplane, arrive, take a drug test, and go from there. So you oftentimes don't get much notice and don't really know what's going on. Finally, there is an ethical debate about strike nursing. Some nurses refuse to take on strike contracts because they feel that it truly undermines the fight for better pay and better working conditions for nurses around the United States. So is strike nursing worth it? If you are in it for the money, you can handle the long hours, the unpredictability, and the pressure. Of course, it's an option. But if you are uncomfortable crossing picket lines, then it probably isn't for you. I want to hear from you. Would you ever be a strike nurse? Is this something you've considered in the past, or are you totally against it? Let me know in a comment below. And if you want more nursing career tips, especially when it comes to travel nursing, make sure to subscribe to my channel and let me know what kind of content that you want to see. Thanks for watching, and I will see you guys next week. Bye.